Okay. Well, welcome everybody. Again, this is Shawn Stevens. I'm here in United Way, Delaware, a rather huge state on the East Coast here. I'm not sure that how much my journey matches yours, but certainly this is something near and dear to me. I love to do this here, and I love to do this with students at a local university. So outcomes are kind of my life, but I like this. I like this part. I kind of liken it to at this point about sometimes changing the culture, besides all the activities that we have to do and move along here. Maybe just to give you a quick context, we're a United Way that has about a $22 million campaign. We have about $6 million that we give out in allocations to about 110 programs a year. We give another 1.5, 1.6 million out in initiatives, community initiatives that we've kind of worked with partners to develop. So you can see there's a whole bunch of other money that we either give out in designations or, quite honestly, go to other states because we're also a small state that has corporation laws that has big banks and stuff like that. So they do their employee campaigns here, but it goes other places. So I think like most of you, I think that the need to do this was kind of obvious. If we have about 110 programs, and we started it several years ago for them to develop logic models, and it's each one gives me logic models with 3 or 4 outcomes. And then you can do the math. We have about 400 outcomes, and how do you tell a story with 400 outcomes? So that's why working with outcome measures is kind of critical to us to, certainly let the community know, let other partners know, why we're investing, what we're investing in. We also do have programs that we categorize under all 3 pillars. I know things vary from United Way to United Way, so we have a lot of initiatives in each one. But again, trying to tell that community impact story means we've got to find a way to bring some similarities to what we're talking about. So I kind of use this as an example with a number of people. So imagine if you could say, last year the graduation rate in Delaware increased 5% from 81 to 86%. 16 United Way of Delaware funded partners contributed to this impact through outcomes achieved through mentoring, after school, community schools, whatever else you can add in there, like creating and supporting individual changes in school attendance, parent engagement, academic improvements, and whatever else you want to add in there. We would like to say things like that. The difficulty is how do we assure that we're measuring the same stuff from program to program? So, like all of you, I think we'll all easily agree that trying to develop some common outcome measures and standard indicators is the goal. Certainly not a trailblazing concept, but as I keep saying, certainly a trailblazing implementation if you can get that done. And as we go along, I've talked to Don before. If you have a question as we move along, that's fine. We don't have to wait to the end. I'm hearing no breathing, no voices out there, so it's kind of different for me here.
All right, everybody's kind of is actually muted right now, and if you guys do want to ask a question, just raise your hand. It's a little raise hand thing on there.
So I guess one of our first steps a couple of years ago was to get everybody really thinking about what it is they did in their programs in terms of their resources, their inputs, the strategies and activities, their outputs, and finally their outcomes. And so like all good processes, we had everyone create a logic model as far as the funding process so that they could articulate that. So that kind of gave us a baseline to identify, did people really understand outcomes, were they articulating them well, and how were they measuring things? So it was a start, and it was also not only a start for the partners, as we call them, but also to volunteers and stuff in terms of how they look and assess the funding applications as they came in. So again, this is kind of common to all of you, but, throughout this process, we had a variety of things that we wanted to do. We wanted to engage our Community Impact Committee and other volunteers. We wanted to make sure that if we're going to invest in something, it's in line with whatever outcomes we articulated through a number of different documents we have internally and externally. Obviously, we want to identify the partners that really produce community impact. So if we have, 8 organizations that are doing something common in workforce development and it's having an effect of some type, we want to be able to measure that. We want to get a better process for funding applications. Right now we have a couple of different ways. And again, engage the volunteers in the evaluation process. And I think one of the most critical things is how do we really articulate our investments? Not only in broad categories under pillars like education, income, and health, but more specifically about the types of programs that they are. and obviously the thing that everybody wants, track, measure, analyze, reports. I'm sure you all get the same thing. Can you give me data about? And we're constantly trying to find data, but if you don't have common outcomes and indicators, it's a problem. And like all the marketing people in communications, how do we tell our community impact story? So after the logic models, then we have to figure, are the programs really aligned the way we want them to be? So that's kind of another evaluation process. I liken this whole process to kind of a qualitative research project, because that's what the journey has been. It also took a while in the past couple of years to kind of redefine, because we had programs listed in what we called strategic focus areas, and we had 5, and we put those 5 down to 3: education, income, and health, and now people don't know what a pillar is, but that's another issue. And now we also have an internal document, Live United 2015, which identifies goals and stuff like that. So our first thing is, how do we align and make sure there? And some of that was self-reporting, partners saying, I feel that our program is under that, and some was kind of discussion. But at least it started the discussion over the past couple of years, so people now are thinking kind of where their program fits and how they relate to others. The first roundabout, we had already been on a process to say, how do we evaluate the programs? And we had broad categories, high need and high quality. As you can imagine, high need, we didn't strictly define that. High need obviously can be defined in terms of service to individuals and families with low income, but we also know that there's other characteristics of the high need. And the high quality, are they relevant to programs? Do they fit under education, income, and health? And do they follow a logic model that spells out specifically the strategies and activities to achieve the different outcomes? So alignment has, been a long time process and an ongoing process, and this is just kind of highlighting some of the ways, some of the specific aspects of outcome measurement for our logic models. So the next step was, after we developed these logic models, after they had a little practice with that, is how do we now go and get these 400 plus outcomes into something manageable? And I've certainly been the voice person saying there are a discrete number of outcomes in our communities. We all like to say our communities are so unique and everything's different, and I would suggest that they're not that different, that the things that we're looking for in terms of education, outcome, and health are pretty common to most communities throughout the United States. If we're looking to increase the graduation rate, that's pretty basic. How we do it might change from community to community. So we did a variety of things. I kind of categorized the agencies into the similarity of programs. At the same time, we were also on this road to get people put into impact track, and we started that not quite 2 years ago at this point. We also have initiated a new process for submitting management review information, and if you guys don't know that, that's just documents and establishing them. And then we needed to establish stated outcomes and indicators, and so that we can develop a better funding process. So the first step that I did was to, again, try to organize our probably about 60 partners. Again, that's about 120 programs that are funded, but 60 partners, and divided them by groups. And the reason for that was to start to engage them in a series of meetings to discuss some commonalities of outcomes. So this was kind of my first category through the different types, and I'm sure most of you can relate to that. It just didn't make a whole lot of sense having people who did healthcare programs necessarily in the same room with senior support services. I know there can be some integration overlap, just so we can more quickly